Hi, it's Dr. Dave, your New York City certified Cox Flexion Distraction Technique chiropractor and director of Synergy Wellness, Chiropractic and Physical Therapy on 14th Street in Manhattan, New York. Today we're going to discuss everything about the amazing Cox Flexion Distraction Technique for stenosis, disc herniations, bulge discs, nerve impingement, or post-surgical cases, including and not limited to spinal fusions. If you suffer from chronic nagging pain, then you need to listen to this entire video. Cox Flexion Distraction Technique for chronic pain is used by chiropractors trained specifically in the Cox technique method. About 1/3 of Americans report that they suffer from some form of chronic pain, and that is the #1 cause of long-term disability in the United States. According to a 2019 Department of Health and Human Services report, pain affects more Americans than diabetes, heart disease, and cancer combined. Many Americans suffer from chronic lower back pain, neck pain, and migraines, caused by a long list of conditions that can be treated with non-invasive chiropractic care, and more specifically, Cox Flexion Distraction Technique, and is considered the gold standard and is the most researched chiropractic procedure. What is Cox Flexion Distraction Technique? One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you, appreciate all of you. The Cox Flexion Distraction Technique was pioneered by Dr. James M. Cox, from whom it gets its name. It does not, as some people assume, derive its name from coccyx, the tailbone. Dr. Cox, a chiropractor, whose father was an osteopath, combined his knowledge of both fields to develop the Cox Flexion Distraction Technique. This is part of a set of protocols or systems called Cox Technique. Experts have researched and perfected this technique over the last few decades. It is currently one of the most researched chiropractic techniques in the world. Cox designed it to reduce spine-related pain greatly. It is a non-invasive manual spinal manipulation performed on a specially designed table by trained and certified doctors. Cox Flexion Distraction is a hands-on technique. As a certified Cox technique practitioner, Synergy Wellness in the East Village in Manhattan applies precise amounts of specialized manual manipulation to pertinent points within the spine, in tandem with a smooth rhythmic motion. This gentle spinal decompression decreases pressure on herniated and bulging discs and the nerves that run up and down within the spinal column, as well as those exiting the spine as they run to different parts of the body. So a seemingly unrelated pain in another part of your body could actually stem from a pinched spinal nerve. Flexion distraction equipment. Well, Synergy Wellness in New York City uses 2 flexion distraction tables, including a brand new Cox 8 table. This is the latest of their tables. This table provides the flexion in the procedure. A Cox table has several articulated segments. These segments are raised or lowered to bring the different portions of the spine into play. Then, during flexion and distraction, the doctor will push the relevant sections of the table down while manually manipulating the targeted vertebra. The patient typically lies face down on the flexion table, but from time to time we do perform this technique sideline for those in too much pain to lie down in the beginning of care. By adjusting different parts of this table, we can apply gentle pressure at the targeted area while using a rhythmic motion to gently relieve pressure on affected areas of the spine. We also combine the use of a PTLMS machine to relax muscles, reduce spasms, and free up muscle adhesions to allow for more motion of the spine. So how does Cox Flexion Distraction help reduce or eliminate chronic pain? This well-documented and researched technique helps relieve pain by reducing the pressure in the spine and on the spinal nerves and returning motion to the spinal joints. Like spinal decompression, it helps to separate and realign troubled discs. It also encourages the flow of blood and healing nutrients around the damaged or troublesome portion of the spine. When performing this technique, one of the things we're doing is foraminal gapping. The foramina are the spaces where the nerve exits from the spine. By opening up the back area of the spine where these nerves exit, it reduces the pressure between the vertebrae. This reduction of pressure sucks in a protrusion pressing on a nerve, like the sciatic nerve. So this is extremely beneficial for those who suffer from sciatica pain. When combined with cold laser therapy, our outcomes improve even more. Make sure you check out that video, the difference between cold laser and LEDs. The Cox Flexion Distraction technique can also be incredibly helpful for anyone with spinal stenosis or post-surgical pain. We typically see a 40 to 50% reduction in pain within 4 to 5 weeks, with even better results at 10 to 12 weeks. What conditions can be treated with Cox Flexion Distraction technique? The sensation of pain is a red flag or warning signal that something is not right. Acute pain, like when you touch something hot and pull away, is short-term and generally subsides when the cause is removed. Chronic pain is recurring or constant and indicates that something is still amiss. Pain has a source or cause. Sometimes these causes can be fixed or cured, and sometimes they can only be managed. Many people suffering from chronic pain wish to avoid long-term prescription drug use or invasive surgeries or injections. Drugs, especially opioids, tend to just mask the problem. There may be a time and a place for surgery in some cases as a last resort. Chiropractic options look for the root causes and offer successful, non-invasive treatments for a large portion of people seeking relief from their constant or recurring pain. In many cases, the Cox Flexion Distraction technique for chronic pain can reduce or eliminate the need for medications or even surgery. Here are some common spinal pain-related conditions that respond favorably to Cox Flexion Distraction technique. Pinched nerve conditions such as sciatica. Make sure you watch our video on how to get rid of sciatica fast. Low back pain, spinal stenosis, disc herniations, disc bulging, neck and arm pain, leg pain, radiculopathy, numbness, tingling, or a pinched nerve, spondylolisthesis, which is a forward slippage of a vertebra, degenerative disc disease, facet syndrome, pelvic pain, headaches and migraines, compression defects, loss of spine lordosis, loss of range of spinal motion, whiplash type injuries, pre and post-surgical pain, failed back surgery syndrome, scoliosis to maintain mobility of the curve, osteoporosis, transitional segment or Bertolotti's syndrome, pregnancy, back pain, subluxation, postural faults. Watch some of our videos on forward head posture or upper cross syndrome, mechanical back pain, such as what companies ankylosing spondylitis, osteoarthritis of the spine, patients not able to tolerate vigorous adjustments, synovial cyst, coccydynia, fibromyalgia, neurological diseases like multiple sclerosis, cerebral palsy, stroke, DISH, diffuse idiopathic skeletal hyperostosis, Klippel-Feil syndrome, knee pain, and more. Since every case is unique, it is expected that individual outcomes will vary. However, the decades of studies and research on Cox Flexion Distraction show that the benefits received by most patients are fairly typical. Here's a few case studies for Cox Flexion Distraction. Case number 1, lower back pain. A 46-year-old man with a complaint of severe low back pain, as well as disabling pain and tingling in his right leg. His pain was so severe that he needed assistance from his wife to enter the doctor's office. He had multiple lumbar disc herniations and severe radiculopathy. After 11 total visits using manipulative treatments, including Cox decompressive spinal manipulative therapy, utilizing Protocol 1, he's doing really well. He returned to his normal daily activities and continues to be physically active. Case number 2, leg pain. One 50-year-old woman was seen for treatment for left-sided radiculopathy and paresthesia down her entire leg to her foot. Her pain was on and off over 3 years, but had become constant over the previous 10 days. The pain was aggravated by standing for long periods and regular activity. She described her pain as a 10 on a 1 to 10 scale. She had a severe antalgic lean away from the painful side and posture and could barely walk, sit, or stand for more than 10 minutes at a time. After her 5th Cox technique adjustment, she described her pain as a 0 out of 10. She's currently living a drug-free, pain-free lifestyle. Case number 3, post-surgical pain. Another woman, 47 years of age, was seen for lower back pain, right leg pain that started about 20 years earlier in her hip joint during pregnancy. She had back surgery for a disc herniation at L5S1 in 2005, and the return of the leg pain was noted within 2 months after the surgery. Flexion distraction manipulation was added to her overall treatment plan. It was applied for a period of 3 months with a total of 31 visits. The patient's ability to walk continued to increase until she had 100% relief of both back and leg pain at the completion of her full treatment plan. Relief from chronic pain without prescription drugs or surgery is possible. With a customized treatment plan that takes into account your unique situation, there is hope for you. Not all chiropractic techniques are equal. If you've been to a chiropractor with average results and want to try something different, something scientifically proven, give us a call and schedule your free X-ray or MRI second opinion. Synergy Wellness, Chiropractic and Physical Therapy in Manhattan is a certified Cox Technique chiropractic office. Contact us today for a better tomorrow.